The US Centers for Disease Control and Prevention, including new language on the agency's website that disputes long-held evidence surrounding vaccines and autism.
News Center Maine's Drew Peters has more from health professionals and those in the autism community right here in Maine who are now speaking out against that decision.
Down to 3 cars, now down to 2.
For more than 10 years, Ellsworth native Tyler Davis has been getting support for his journey with autism at the nonprofit Down East Horizons.
Due to the nature of it being a genetic thing, it's always been with me, but thanks to early intervention, I have been able to overcome some of the disabilities.
But following the US CDC's new website notice linking vaccines as a potential cause of autism, he fears others on the spectrum may not get the intervention they need.
Because now people think, as long as we don't do vaccines or anything, then autism will stop.
The CDC website's new language specifically stating, the claim vaccines do not cause autism is not an evidence-based claim because studies have not ruled out the possibility that infant vaccines cause autism.
Well, first of all, that's not true.
It isn't just those in the autism community speaking out, though.
There are many more research papers proving that there's no correlation between autism and vaccination.
News Center Maine political analyst and former Maine House member Joe Bruno, a Republican, owns pharmacy practices throughout Maine and worries the CDC's rhetoric promotes distrust in vaccines.
The last thing we need to do is put doubt in anyone's minds that being vaccinated is going to harm you in any way.
Backing Bruno's fears are leaders with the Maine Public Health Association.
This is counter to decades of scientific research that has shown that not only are vaccines safe and effective, they can save lives.
Refuting the criticisms, CDC officials say research supporting the link has been ignored and that the rise in autism since the 1980s has correlated with the rise in the number of infant vaccines given. Writing in part, HHS Secretary Kennedy has launched a comprehensive review of autism's causes, including investigations into environmental and biologic factors, with an emphasis on transparency, reproducibility, and gold standard science.
It would have to be dramatic to convince any healthcare practitioners.
Drew Peters, News Center, Maine.
Bruno and officials with Maine Public Health do recommend asking your physician or healthcare provider any questions about the safety or effectiveness of vaccines.